Hello, good morning, everyone. How are you? We'll wait for a couple stragglers to come in. As we wait, I'll introduce myself. My name is Bennett Porter. I'm the Chief of Staff at CALM. And our mission is to help everyone on every step of their mental health journey. And I'm excited to spend the next 45 minutes with you and our illustrious panel talking about holistic health, really the link between mental health and physical health. So before I introduce our panel, though, just a show of hands here, quick hands up. Let me ask you guys a couple of questions, which is, whenever you get a little bit nervous or anxious, do you ever feel like your breath getting a little shallower? Yeah? You do? Do you ever feel like your heart starting to flutter, or you get a little nauseous? My daughter always comes, I can't take the test, I feel nauseous. But butterflies in the stomach may be a better way to talk about it. These are all signs of the connection between sort of the mind and the body. And we're excited to unpack that today with our panel. So let's meet them today. Let's start right here with Dorothea Scitalia. Dorothea is the Senior Director of Emotional Wellbeing from Comcast NBC Universal, where she oversees the company's overall design and strategy for mental health benefits, preventative resources, digital solutions, plus other programs to help employees manage work-life priorities. Thank you, Dorothea, for being with us today. Dr. Chris Masonic is my colleague and CALM's Chief Clinical Officer. He plays a key role in shaping CALM Health's evidence-based programs and spearheading our clinical research. Chris is a licensed clinical psychologist and registered dietitian. Next up is Yusra Ben Halim. She is a triple board certified psychiatrist and the Senior National Medical Director within Optum Behavioral Health Solutions. And she is focused on helping individuals, families, and populations connect with solutions that improve their well-being and health outcomes. And finally, Melinda Morimoto is the Senior Benefits Director at Genentech. She leads a team of strategic rewards partners who design, manage, and communicate leading-edge benefits for over 22,000 U.S. Genentech and Roche employees. Please give our panelists a quick round of applause. So I'll start, Chris, with you. We'll start, Dr. Chris. What do you think, or why do you think we need to think differently about how we treat mental and physical health? Really, what's at stake?
So everybody in this room is already aware of the mental and physical connection. So we don't need to go into that because you wouldn't be here if you weren't. We can all go a level deeper today, and what's at stake in the mental health world is our credibility at this point. So in order to help people with their mental health, we can check 3 boxes. Okay, the first one is essentially acknowledging that people are short-term creatures. Okay, you have 3 seconds to get their attention, do something that keeps their attention. 3 seconds. We're at a digital mental health conference. Everybody knows that. The second thing is human beings love to be entertained. We love it. We love to be entertained. We love stories. We love stories more than anything else. If any of you had early stock in Netflix, that's wonderful. We have Comcast here. She knows. People love to be entertained. Got that checkbox too. We all understand that. The third part is treatment. Being able to have an effective mental health treatment delivered in a way that people trust, that's what we're all struggling with. And what I mean by that is if you ask the average American, hey, you have depression, you're going to go get treatment, you know it's going to feel better, right? No. Nobody goes, yeah, I got that depression thing, going to go get some CBT, done. Nobody said that ever. We want to be at the spot where that is the case, and it's going to take a while to get there. We can look towards physical medicine and go, oh, they did a great job. Okay, MDs back in the 1920s, I don't know, it was a little bit different. My grandfather would tell me stories about getting a haircut and his fingers almost chopped off when he had a cold, when he went to see the doctor. No trust whatsoever. That's changed. Now, if you have a cold, you essentially can go to the doctor. You trust that you're going to get antibiotics or whatever it is, and you're going to feel better really soon. We have to develop that level of trust in mental health, and being able to do that means getting treatments out there that people see as effective in a way that's entertaining and engaging. And if we don't do it, then we're not credible. We got to do it and soon, because people are just going to go, hey, if I keep on getting this treatment and I don't feel better, it's going to be a problem.
Yusra, let's talk about your point of view. So, at Optum, what exactly does whole health mean to you guys?
It's a great question. Is this on, or do I have to press the button? I think you can hear me. Okay. Hardest part is over. So at Optum and United Health Group, we have an incredible mission, right, to really help people live their healthiest lives and make the healthcare system work better for them so that that can happen. On the Optum side of things, in the behavioral health space, where I kind of work with incredible people day to day, this is not a new concept for us, whole person health. When we think about the history of behavioral health, of psychiatry, of psychology, we've really always thought about the whole person. We've never sort of thought about us as just the neck up, but that is the way that the healthcare system is built. And that is also the way that physical health clinicians really practice and think about treating a person's health. And so at United Health Group and Optum, we have these incredible opportunities to work with talented people across both the physical health space and the behavioral health space, as well as everyone in between. So all of our non-clinicians are really a huge part of our success in being able to think critically about what is the right evidence-based care, but even more importantly, how do we help whole people throughout their whole lives? And one of the things that I'm very grateful for at Optum is we don't just wait for people to come to the healthcare system after they have a healthcare need. We really think critically about whole health as a lens to think about how we help people live healthy lives by being well throughout all of the moments of their lives, including when they need healthcare, behavioral health, or physical health. And there's a lot more work that needs to be done because, again, the healthcare system is not built in a way that is very receptive to this integrated approach. If it was easy, we would have solved it by now. But we get really excited about whole health going beyond just a clinical care need, beyond treatment, and really thinking about ways that we can engage people and thinking differently about what does it mean to be well? What does it mean for me or my children to be healthy and be able to live healthy and happy lives?
Yeah, that's a great point. I want to actually ask Melinda if that resonates with her, but before I do, I just want to mention that Genentech has been on the best place to work list 15 consecutive years and has been ranked #1 best place to work 8 times. And you and your team take care of all of these people dedicated to Genentech's mission to seek solutions to unmet medical needs. How do you support, and how does Yusra's message resonate with you as Genentech's employees pursue that mission?
Oh, thank you for the question. So we have a very diverse workforce. We are manufacturing life-saving medicines. We're trying to find the next diagnostic. So our workforce is medical doctors, lawyers, PhD researchers. It's also manufacturing and distribution, running 24/7, 365. So for our workforce, we need broad access. And that's one of the things that we've, over the years, really been able to build out with Optum. So I was a little surprised when they asked me to speak because I think I've been one of your toughest clients, certainly one of the most vocal. I took it as a moment of extreme pride when Sir Andrew Whitty thanked me for making you better. So we'll start there. And a couple of things that we've done along the way. So we have a dedicated health team. We've had them in place for 6 years. The last thing I negotiated before we awarded the business was 2 mental health clinicians that sit in our health team. We've since expanded to 4. So if a member calls in and they have a new diagnosis and they're struggling, there's a screening level and a referral over to a mental health clinician who can support them.
A diagnosis of mental health, the physical health?
No, physical. If someone has a new, let's say cancer, diabetes, anything, they're screening for and ensuring that they're getting help in that moment. They are working side by side with a colleague of mine whose daughter's moving from inpatient to residential and finding that next right step. So this idea of really supporting the individual and the caregivers is so important. The last thing that we rolled out a couple of years ago with Optum is a 24/7 helpline. It's the opportunity to call in anytime life happens, be de-escalated in the moment, and then referred out if you need more help. So those are some of the things that Optum is doing to help our workforce so they can focus on producing our life-saving medicines.
That's excellent. Now, not to be outdone, Dorothea. For the second year in a row, Comcast NBC Universal has been recognized as one of the top 10 of the 100 best companies to work for. And you and your teams serve more than 100,000 employees in both remote and in-person roles across the United States. Now, from your perspective, why do you all focus on whole health? And what are the benefits of this holistic strategy and examples of programs that are making an impact for your workforce?
Sure. Am I on? Maybe I'm now? Okay, I passed. So similar to what Melinda said is that Comcast has a very diverse employees. So we have over 100,000. We're not just spread out throughout the United States, we're also global. We're in 30 countries. And just as our employees are very diverse in, geographically, their demographics, what roles they play. I mean, we also have employees that we have from NBC, we have from journalists to theme park operators, and at Comcast we have technicians, et cetera. So we have to meet our employees where they are. And so we try to be thoughtful about how we structure our benefits, because there's sometimes employees don't know where to turn, and they may have, one day they may have a physical need, another day they may have a mental health need. So we have our benefits structured in 3 pillars. So we have a physical, financial, and emotional, and all 3 of them are equally important. And we do it that way so that we could have like kind of a front door for each one, and then we work so that within the entire ecosystem, we ensure that our vendors, our partners, could help employees refer from one to the other. So it's not a science, it's an art, but it's something that we have continued to work at so that wherever the employee goes, if they have a need, say they start out with like Included Health, which is our health navigator, and they have a need for financial, they'll know how to get them to the place where they need to be. And I think that's one of the ways we do it. And the other way is just ensuring that we're continuing to reinforce the messaging, making sure people are aware of the programs we have, so that when they need something, they know how to access it. And then for like kind of an example of kind of how this sometimes, it's a little bit of a unique example, but so NBC does the Olympics. So, it's a very intense time. We have a few thousand contractors that are in a different country, away from their family, and it's such a small amount of, like they're working like around the clock. So we set up a clinic at the site with our physicians, wow. And we also now include mental health, which is 4 years ago, we didn't do that. So that's something new. We're moving in the right direction. But also, we gave all of these contractors the COM app this year as well. We got so much feedback that, the utilization was great. They really appreciated it. So it's really, I think, being thoughtful about thinking about, obviously the whole person and what situations they may find themselves in, that might be unique.
And so follow-up question for you and the rest of the panelists here, which is how do you measure impact? How do you, when you roll out programs and benefits, what's the impact, or how do you gauge success?
I'm happy to speak to that. So part of it is utilization. And we're really proud when we look at our data, our utilization for mental health mirrors our population. So we're looking at gender, race, ethnicity. That tells us that we're reaching all the demographics that we need to be able to reach. I was told at our benefits fair, you have no stigma. Like, people are walking up and talking about their very personal, what you would think would be personal, private mental health journeys in front of their colleagues. So the ability for people to reach out, that our leaders know when life happens, a transformation, something in the world, they're constantly reminding our employees of the available services, those are ways we know it's working.
Dorothea, any
I
other
think
thoughts?
it's very similar. I think I'll add that we do look at utilization, of course, but then we also look at engagement and how often people are using the benefits, in what way, and also trying to see if we could connect the dots. Our data science team tries to connect the dots with, say, is somebody who's using our EAP program regularly, are they not going out on a leave, or is that helping to reduce the percentage, or those kind of things.
That's great. So digital solutions, Yusra, I'm going to ask you this question. Digital solutions are opening up a whole new world when it comes to accessing care. In fact, a survey from Peterson Health Technology Institute found that health plans, employers, and health system plans continue to grow their spending on digital health offerings. What role can digital tools play in providing patient-centric care and treating a whole person health? And what do you look for in a good digital solution?
Great question at a behavioral health tech conference, which several years ago I never thought would ever exist, let alone have people come and want to participate. So I think taking a step back before we get patient-centered, and again, thinking again about that, the human being, right? Whether we call them a member, a patient, an employee, a consumer, and really, again, thinking about what is the role that technology plays in the lives of us as human beings, in the lives of our families. Not all good, not all bad, but thinking about the positive impact, that it's convenient, that people can access it 24/7, and they can access it in ways that they choose, on their phone, online, on their desktop, that it is something that people can tap into in those moments when that readiness to take action is actually present. And then I think a component of it is that people can come back to it when they're ready. So they come to it in those moments when they're looking for something, and then technology allows them to come back when their schedule permits, when their life has another need. So there's that level of continuity that technology provides, and that follows a human being wherever they go, when they go to work as an employee, when they're at home as a mom, when they walk into a clinical environment or tap into an online health session and suddenly become a patient. So when I think about technology, I think about the term sort of digital tool, and always reminding ourselves that these are tools. These are technologies that ideally are allowing us to optimize all of the great experiences and services and solutions that already exist. They can amplify reach. They can foster more connectivity in real time to really meet not only a consumer or a patient's needs, but also their preferences. How do they want to engage on their own terms? And then I think these tools also give us an opportunity to actually change what's not working, to be able to now bring something net new or bring it to the people that we serve in a way that we couldn't do without technology. And sort of thinking about it critically like that, on that foundation of a human experience, and then seeing that technology as a tool to make things better across the board.
Example?
Yeah, so I'll use Calm Health as an example. So when we think about apps in general, or just online experiences that you can access on your phone or online, they serve multiple functions. And so one of the things that we think about at Optum, and I think about from a mental health perspective as a psychiatrist, is what is the function it's trying to serve? And one of the first things that sometimes worries me is when people present something to me and they tell me all the different things that it can do. So ideally, the technology and the tools should really be focused on doing a few things or one thing very well, not trying to do everything. And then thinking about the evidence behind it. I know all of you have heard the term evidence-based care, evidence-based practice. If we take a step back, though, we're just talking about evidence first. What does the data show that this tool can actually do? And does it do what it says it can do? So when we're thinking about clinical interventions, absolutely we have to think about the evidence behind that clinical experience. But we're also thinking about tools that maybe aren't clinical in nature, but are clinically informed, that are framed around the building blocks of what we know to be effective in clinical experiences, and then measuring that measuring how well is it actually performing that function, whether it's subclinical, non-clinical, or clinical. And then I think another opportunity is to think about the experiences in the sense that it can't just be about what we designed it to do and what we believe it should be performing as. We have to get that consumer feedback. So you can build the best tools, you can build the best care, but if people are not going to engage in those experiences, then we've really not solved anything. And so coming back to the example of Calm Health, so we rolled out in September. So we're still very early, excuse me, in looking at the data qualitatively and quantitatively. But from the get-go, we can see that our hypothesis was correct, that combining that brand recognition, that trusted experience that Calm already has with people across the country, and then partnering with the United Health Group and the brand and the trust that we've established with our members and with our clients, we're seeing engagement rates, in a very delightful way. We're seeing people engage. We're seeing people download the app, log in to the online experience. And so what we'll continue to do is to track what does that engagement look like over time. It's not just about the hook in the beginning. It's also about what are people doing when they are in that digital experience or utilizing that digital tool. How is it working for them? Where are their gaps and misses? And then being able to really track the data and come back to that sort of sense of rigor of testing the hypothesis and asking, is this tool really doing what we all envisioned it to do from the start?
Now, Dr. Chris, I'm asking you a question, and I'm not being facetious about this, which is I want to know, is the mental health advice I'm getting in my TikTok feed about what Yusra is talking about, what's the difference?
Say that one more time.
The mental health stuff that you see on social media.
Oh.
A lot of people, in terms of, it's meeting them where exactly they are. But is that what we're talking about?
So, in a way, yes and no. And the yes part is people want to be entertained. And Calm essentially has nailed, way before I came into Calm, wellness, like nailed it. Entertaining. There's 45% of our narrators are BIPOC. If you like Matthew McConaughey, like his voice is amazing, it puts you to sleep. If you like Jay Shetty, it's great. That's real. That's how you get the hook in, right? And it's trusted. We've been doing it for 10 years. The mental health part is the bigger challenge, right? So Calm, everybody's aware of that, our brand. Calm Health is our newer app that's going into the mental health world in the subclinical mild space. So we triage folks using the PHQ and GAD, and then essentially if they're in the mild subclinical area, we essentially deliver programs that are written by clinical psychologists with an evidence base that's as strong as it could be, that are experts in their field. So when you have an expert writing a program, the content is super easy and palatable. That's how you know you're talking with an expert, when they make something super complex, really easy to understand, right? So those are our authors. But the narrators are the Matthew McConaughey's of the world, because you got to have that engagement. The problem we have now on TikTok and other forms of social media is that the loudest voice, the most entertaining voice, the most engaging voice, that's the one people trust. So people who are non-clinical, who have an amazing voice and have an amazing style, will bring about topics, and people will be like, oh, it was my endoplasmic reticulum that was ticking that essentially made me anxious. Where'd you hear that? But it came from a podcast, and it has 1 million views, and it's going to be how people get their entertainment. That's not changing. It's how they're going to get their mental health treatment. So being able to have that engagement factor, but have the evidence behind it, that's what Calm Health does. So we're bringing that part of the mental health continuum into place, where we're getting those two things nailed. And like Yusra was just saying, we're just starting. And a great product and having a great product team is a big part of how we do this, is that we get this feedback and we're able to essentially pivot, whether it be a program where people, let's say we just rolled out with Optum, right? 13 million people. We get feedback saying X, Y, and Z programs, they're not working, they're not getting engagement, we'll fix it, right? We want these programs, we'll fix it. Being able to have a viable product means having a flexible product that takes that feedback and you can iterate on and be able to make the whole entire experience from engagement to outcomes fast, better, over time, never stagnant.
And Melinda, Dorothea, I wanted to talk to you guys about sort of how things have evolved in the workplace over time when it comes to mental health and mental health offerings. You'd given the great example of the Olympics and now having folks in the tent to treat mental health in addition to physical health. As you guys have looked at EAP offerings, which is traditionally what we think of for mental health, how has that evolved over time? And how do you guys address that? And do you see more of a willingness to talk about mental health from the get-go in your workplaces?
Yeah, so I'll start. So EAP programs aren't enough. The way we look at it is there's a spectrum of care, of course, and you need to make sure we have programs for, on one end of it is like prevention, and then as people move up the spectrum needing higher levels of care, et cetera. So we want to make sure we have programming across the spectrum, and we all know people move from place to place or along the spectrum. So couple things that we think now are super important is making sure that we focus on prevention. And so that's where I think CALM comes in, and we've seen, you mentioned the stigma. So after the pandemic, I think we've all experienced that the stigma is better. I mean, I think people are more willing to talk about it, especially our newer employees. So that's definitely helpful, and we want to meet them where they are. I think CALM is a nice way to get people in to talk about mental health without a stigma. There's never a time where I do a benefits presentation where not somebody writes in the Teams chat and starts a whole big thing about the sleep stories and about meditation. That's mental health, but they're comfortable talking about it. So that, I think, is how we get people to not have to move up the spectrum of care by kind of building mental fitness, just like we do, work out and build up our physical fitness. And that's how our company, I think, builds resilience. And, we all know things come up in the company, things come up, in the community, whatever. So we need our employees to be able to handle those kind of challenges and reach their potential. And I think that's kind of how we build that muscle is earlier on. And of course, making sure that we have programs along, when they need higher levels of care. And I think to address your question or your point about talking about it, I've also seen that evolve. We have a day that we have mental health awareness. We do World Mental Health Day. That's something new, and it used to be a footnote. Now people are involved. We have one of our top executives at our film group at NBC is super comfortable about telling his story and how he was depressed and his journey. And so we have these spokespeople that are building credibility, so we tap into that as well. And that obviously helps build the awareness and makes people more comfortable. Because I think the more we talk about it and we normalize it, the more I see employees willing to get help. And there's time, and we know there's still stigma, especially in some of our countries, some of the cultures. But I just love it too when, I had to do a presentation to our Asia Pacific group, and I had somebody reach out to me after, said, it's so nice that we're talking about this. She says, I grew up in a culture where you couldn't ask to ever get help. And she says, it's just making me feel more comfortable to get some support for myself and my family.
Melinda, any thoughts to add?
Happy to. So from a workforce perspective, I think there's a lot of things employers can do. For us, mental health is the #1 cause of disability after pregnancy.
Oh, wow.
That's real. These are people out of work and suffering. Things that we've done. So interestingly enough, we didn't talk about evidence-based care and mental health until the last 5 to 6 years. So let's start with that as a paradigm change. I'm still hoping we get to a point where we just talk about health and we stop delineating. But that's my future vision, why I'll be in this industry a few more years and vocal and loud. From a workforce perspective, things that we've done that I'm really proud about. We have over 400 mental health champions across the United States in every line of business, in our business resource groups, the different geographies, who are continuing to promote resources and education. We have mental health training, and we rewarded employees through Rally last year to actually take the training. How to spot signs of distress, and how to engage in those uncomfortable conversations. And hey, manager, the worst thing you can do is look away. This is your job. You need to pay attention and help connect with people. I have a colleague who's brilliant in this space. When she told me she was going to do, this was I think a year and a half ago at Mental Health Awareness Month, a suicide prevention webinar, I was like, okay, that's a tough topic. 900 employees attended virtually with 50 in the room. So when you think about what can we do from a workforce perspective, there's a lot you can do, but you have to do it boldly and loudly. And the hardest part, I think, is reaching the family at home. Because I will tell you, if your child is struggling with mental health, it's hard to sit on a stage and not think about how quickly you can fly back home. It's real.
And may I add to what Dorothea and Melinda had
Please.
said? So, you know, I work a lot in the employer space, and so it's been a privilege to work with colleagues like Melinda and Dorothea. And so I never take for granted that years ago, this would not have, behavioral health, mental health would not have been a topic that employers felt comfortable going into. It was never a matter of should we, I think it was more a matter of how do we, in a way that first do no harm and, you know, ideally do some good, make some big change for our employees and their families, our members. And so incredible progress has been made, and incredible progress needs to continue in the space of these conversations about mental health. Where I think we're going next and need to go next to really influence the industry of healthcare and the ability to support our community members across all states is to really now say, okay, as we sit in the behavioral health industry, as we sit in healthcare, as we're a payer, an employer, your vision of whole health and not having to start to compartmentalize it is really the future of where we all need to go together. And in order to do that, we need to think critically about the next steps. I think we've learned a lot in the behavioral health space about how do we do this? So how do we start to introduce topics that are part of our whole health that before we weren't able to talk about? And then how do we bring solutions and experiences to people and their families to start to infuse this in their daily lives, in their daily roles? And then now, how do we potentially take this opportunity of reduced stigma and the action that people are willing to take and almost do it in a reverse order than I think people, myself included, thought was going to happen? Which is, are we now at an intersection where people feel comfortable talking about and identifying their mental health needs for themselves and their families? So how do we now plant the seeds of health literacy in language and information to help people start to see the connection between their physical health and mental health, their mental health and physical health? The truth is, if we connect with the healthcare system, if we go to primary care, we're going to get a screener, but our primary care doctor doesn't have time to talk to us about the impact of our diabetes on our mental health. If we go see our therapist is probably going to ask us, how are you doing? And they want to know about our diabetes, but they're not going to go any further to really talk about the connectivity. So what I get really excited about Calm Health is really building that engagement strategy off of that first front door, reducing the stigma to talk about mental health. Now, how do we reach people in the palms of their hands and help them start to get access to the seeds of information to say, you know what, I do have diabetes. Oh, I didn't know there's a clinical program here. Let me click on that. And when they go into it, what Calm Health does is it weaves together this really digestible conversation to really help provide people with the seeds of ideas and perspectives about the connection between their mental health and their physical health, especially if there's a condition that they've identified. I'm very excited to see how people engage with this because, again, I think most people thought it was going to start in physical health and we were going to tag mental health onto it. But the truth is, if that was a successful pathway, we would have been there by now. The healthcare system would have changed. Collaborative care, integrated care would exist everywhere. The tools that are being brought to market would all be integrated. And the truth is, the tools are not integrated. We see tools for specific physical health conditions, musculoskeletal, pain, like you said, pregnancy, where we have recognition on the physical health side that there is a tremendous impact on mental health. But how do we start to have that conversation with consumers so that we not only have a top-down industry shift, but we collectively foster and nurture a bottom-up, and ideally, we meet people in the middle. So the healthcare system, employers, clinicians, payers are really building up that health literacy for consumers, patients, and members to start to think differently. And my hope is that when they think differently, they're going to engage differently and their expectations will change. They will come to a payer, they will come to an employer, they will go to primary care and say, you know what? You can't just treat this. We have to talk about all of my health, my emotional, my social, my physical health. And so again, I'm really excited to see how Calm Health is going to be able to start to introduce that narrative that I have not seen anywhere else in the market. And to be able to see, how do people respond to this? It's very subtle and it's very palatable. And I'm excited to see how it not only changes the way consumers think, but how does it change the way they engage and behave?
And are there any early insights since you rolled out in September at all?
Yeah, so I think one of our top clinical conditions that's being identified by users is back pain, which I can relate to. And you know what? So again, like there are areas of physical health that have a niche, and they've recognized if we add CBT to our physical therapy program, wow, people get better. But again, thinking about it from the perspective of those who we serve and the people we're designing for, we have to always go back with a kind of a humble perspective that we know more, and we are not sharing that with them. And consumers and patients and members deserve to have that perspective too, so that we can support them in making more informed choices for them and their families.
I'd like to open it up for questions, and so if you guys can make your way to a mic if anybody in the audience has a question. But I will, as we wait for people to get to a mic, I'll ask a question to the panelists here, which is, any other strategies that people should look for to bridge the gap between physical and mental and look at more holistic health? Any strategies you'd like to share with the audience?
I just want to expound a little bit on what Dr. Usura just said. The gap is where experts actually are. Meaning, you said it beautifully, pain, diagnostically, okay, back pain. Throw them into a CBT clinic. Cool, there's a huge gap in there. There are experts in the middle who are pain psychologists who just do that, who know this space better than anybody else. But that same pain psychologist knows nothing as the diabetes psychologist. And the psycho-oncologist or the geriatric psychologist, there are experts who live in those gaps. They are super hard to find. They're super hard to recognize. But when you are able to find those people who devote their whole entire careers towards treating that population, that's where you start moving the needle. That's where you start changing the dialogue. That's where you normalize things. I'm not going to ask for audience participation because that's just mean. But when it comes to cancer, if I say, who in this room is affected by cancer, either yourself or somebody in your family, everybody's going to raise their hand. And then I'll ask, hey, how many of you work with a psycho-oncologist? Nobody's going to raise their hand, maybe one or two if they happen to live near an academic setting. The point being is that when you work with a psycho-oncologist who knows the issues related to cancer, who can go over them, put them in a palatable way, it's a game changer, right? But it's hard to find them, it's hard to do it, and that's the gap. It's not bridging the gap, it's living in the gap and embracing it.
We had a question.
Yeah, hi. Deb Smolensky. I'm Deb Smolensky on the HR benefits side. I wondered if you could talk just a little bit more on disability and mental health, and how are the claims being processed okay, or is there a lot of pushback? And also on the long-term care, not being able to get policies because of all the medication people are trying just to get regulated in a way. The holistic benefits and the holistic care, what you are seeing as the employer.
Well, I'll address just the beginning, the disability for mental health, the short term, and then I'll have you add on. So we have an integrated program with our EAP provider where when somebody submits a claim for mental health, they have to see a provider. And that provider will help track. And that's really important because we want to make sure that the employee is getting better. And what we've done is it's like I said, it's definitely evolving. But we looked at regions where we have the highest number of employees going out on claim for mental health. and we've really done some targeting programming. So we had one area where we had people on site, our Telemundo group. So we brought in an on-site therapist full-time to be at that site. It's very early, but we're tracking to see if we see any improvement. So I don't know if that answered your question, but I'll pass it along.
So just a couple of things I might add. So one of the things that we found is if an employee was not engaged in care, they'd go MIA. And then the manager and people relations are like, where did this person go and how do we get them back? So that's a gap that we filled with having basically a triage and assessment through our EAP in coordination with our disability carrier. And I think that's been helpful. The other thing that I think is important is not just when somebody goes out, but the recognition of how do you welcome them back? How do you have those conversations? How do you equip managers to say, how do I best support you in this return? Because it can be so challenging. So those are some of the things that I think are opportunities to sort of close those gaps with the hope that they're recovering and returning to your workforce.
There's 2 questions that came in. One is, I worry that the holistic care models presented would not be realistically deployable among underserved populations. How can we make preventative and whole person models more appealing to payers, investors, and the public health systems so we can serve more than just privileged individuals?
You're looking at me. So yeah, COM was created as a direct-to-consumer app that largely the criticism is valid. It's an expensive app. It's a wonderful app if you can afford it. Working with the payers, the whole point is to be able to reach everybody with COM. And thanks to payers working with us, 13 million people now have access to COM Health, right? It's wonderful. And being able to reach the underserved is the purpose of where we're going in our next generation. And being able to embrace the fact that when you do something, you do it with specificity for a population. That's how it works best. So if I told everybody in this room, we have a hypertension program in COM Health, like I'd put people to sleep in 30 seconds if I started talking about that. If I said we have a hypertension program that's written for African Americans by an African American specialist who knows that community and the issues that they're going through psychologically around hypertension and why they have disparate outcomes, that's a whole different story, right? Being able to get specific and talk to those populations that are underserved, whether it be like the community of color or it be the military, who often go unreported because they're afraid of actually not getting treatment, because they're afraid of they don't get treatment because they could lose their ability to be active in the service. Firefighters, for instance, too. Police officers, they don't go into treatment, they're underserved. So we want to go to those places because we know there are issues, they're underserved, and we want to be able to do it with no barriers in place financially. So it's a completely great criticism, and that's what we're attacking it head on with COM Health.
May I add one thing, Bennett? So if you think about, by the time someone gets the courage to reach out for care, they've had to fight so far and struggle so far, and then it's scheduling an appointment, and it's filling out the forms, and the anxiety of showing up to the appointment. What I love about what you're rolling out with COM Health is I can do it on the bus. I can do it wherever I am. It's quiet, it's silent. I can do it in the moment that I want help. And you're screening and providing resources to someone. So I think that in and of itself removes barriers.
Yeah, and do we have time?
Please.
So I love the question. I think it's very important when we are sitting in privileged spaces and places to always bring equity into the conversation. I think that I would hold the digital and technology space of innovation to the same benchmarks that we as clinicians hold the healthcare system. The healthcare system had the same challenge to solve, which is who are we serving, who do we want to serve, and who are we actually reaching? And the honest truth was privilege was a big part of medicine and access to care, physical health, and behavioral health. And so now that question very much applies to the same sort of evolution and transformation of digital within not just the healthcare space, but also integrated into people's lives. I'm going to put on my addiction and child psych hat on now. we think about reaching people who are underserved all the time. And so I think we all have a place and we all have a role to play. So wherever you find yourself in the entire ecosystem that touches a human life, to think critically about who are the people around you and what are the parts that would impact your success or failure of being able to reach the people that you've identified that you're really aiming to serve. And what I mean by that is that there is a space in the employer-employee relationship. There's a space for a physical health provider or mental health provider. There's also a space in society. When we think about our partnerships with schools, when we think about our work with nonprofits, when we think about locally connecting with community leaders who know the people in that local ecosystem. So thinking about this is not just how do we pay for it and how do we get it into the hands of the people on the bus, but really how do we reach more people when we look at all the touch points and opportunities of the connectivity of where people live and who they come into contact with. So this is not just a healthcare system problem to solve or a digital space problem to solve. This is a societal really call to action that everyone who works with youth, who works with families, who works with the grown-ups really has a role to play and an obligation to make a change here to reach everyone.
Yeah, that's a great call to action that we'll end on. So thank you, panelists, so much for your thoughts, and thank you for your great questions and attendance.